The main aim for Malawi is to ensure that the new HIV infections are completely eliminated. Our goal is to end AIDS as a public health threat by the year 2030.
HIV does not describe who I am, but what I do every day to support my fellow young people living with HIV really describes who I am. I work as an HIV/AIDS testing and counseling counselor. I support young people living with HIV to make sure that they adhere well to their ART treatment and also they are living positively with HIV.
When one is tested for HIV and is HIV positive, there is hope for the future because we'll be initiated on ART for life. One of my successes was a story of a woman who came to start antenatal. This woman was HIV positive, but she refused to start ARVs because she was afraid of being chased away from her home by her husband. I had to give her counseling. So when she went home, she was able to convince her husband to come to the facility for HIV testing. And she also started receiving the ARVs with the support from the husband.
Malawi has made a lot of progress since we had the epidemic in the late 80s and early 90s. We were seeing 75,000 new infections then in the early 2000s. Now the new infections have been reduced to 19,000. But also the life expectancy has improved. We used to have 45 as the life expectancy. Now we are at 63. There have been a lot of improvements in terms of how people access antiretroviral drugs, which are procured through the Global Fund.
Ineyo ndinaizetsa mu chaka cha 2000 ndinaizetsa mwa ARV kulibe pamene panopa nditest and treat.
Since the Global Fund always support our ART treatment, we have never run out of drugs.
Particularly where the treatment program is concerned, Global Fund is a very critical partner because we're talking of lives of people at stake.
Our population is accessing HIV prevention services. What is more significant is that now pregnant and breastfeeding women can no longer transmit the virus to their children. So we are seeing more children born free of HIV/AIDS. These better health outcomes are not just coming from the medicines that patients are receiving. Our health systems have been strengthened, particularly the areas of human resource recruitment and training.
With Global Fund support, we're able to recruit additional healthcare workers, but also they supported both pre-service as well as in-service training.
We have improved infrastructure in terms of availability of buildings or space for patient care, even power to the facilities in the rural areas in form of solar. We have also expanded access of services to hard-to-reach areas, so we have expanded access to almost the whole population and even special population groups.
But when you dissect the populations, you find that there are some subpopulations where new infections are still very high. Example, adolescent girls and young women and key populations.
Kumabenga kandi muno tikwanisa tukozi kuchitika kumale kuno zinali zovuta koma zinatengera kulimba mtima kuti ndafotokozera zinzanga kuti bwanji titambitsa chinthu ngati ichi koma timafuna kuti sex worker adzigwira ntchito yake ali ndi moyo wathanzi ndiye timapatsa ma services amene aja amayezetsa HIV, STI, kafuna family planning.
The main governance structure for Global Fund is the country mechanism, the Malawi Global Fund Coordinating Committee. In this committee, We have representation from the civil society, both international NGOs, local NGOs, representation from the key populations. The MGFCC has got an oversight committee that provides an oversight to the implementation, but also monitor implementation of the activities that are supported by the Global Fund.
With the coming in of COVID, that has derailed the progress that countries would have made, because we are also seeing more resources going to COVID. We want our fellow policymakers from other countries to continue lobbying for resources so that we can eliminate HIV, but also at the same time continue fighting the COVID pandemic.
If there was no Global Fund, it could be chaos in Malawi. Global Fund supports us with a recruitment of nurses and HSAs, COVID-19 test kits, buying of oxygen cylinders as well as oxygen.
If there was no Global Fund in Malawi, I feel like a lot of people would have died of AIDS-related illnesses.
My hope for the future is to see an HIV-free generation in Malawi.
And we can only achieve that if we have continued donor support.